Let's first understand what exactly is Parkinson's disease and how does one really know when they're starting to develop Parkinson's disease?
Correct. So in Parkinson's disease, as we all know, it's a neurodegenerative condition, one of the commonest neurodegenerative conditions. So it's essentially a motor syndrome where patients develop tremors, slowness in movements. Usually one side of the body is involved and then the other side get involved over years. They become rigid and they lose balance. They tend to fall. Their speech becomes low volumed, and they also develop non-motor symptoms. Sometimes, in fact, non-motor symptoms can start before the motor symptoms. Some of these patients do have what is called REM sleep behavioral disorder, like they have sleep talking, they enact during sleep, they enact dreams during thing, they have sleep talking, they can fall off from the bed, that can precede the motor symptoms. A lot of patients do have constipation before the actual motor symptoms come. They may have anosmia. And later, the non-motor symptoms also accumulate over time. They can become depressed. A lot of patients complain of severe pain, sleep issues. So all that can happen. So it's not just motor symptom. It will predominantly it starts as a motor symptom, but there is a lot of non-motor symptoms happening. So it's more like a syndrome. So if you're asking me, so what happens in Parkinson's disease? There is a degeneration of nigrostriatal neurons in the brainstem. And there is a dopamine deficiency, and that's the reason why there is an imbalance in the output to so the networks what controls our motor movements. There's something called direct and indirect motor circuit. So there's an imbalance of that. So the indirect motor circuit becomes more active, and that's the reason why patients become slow and they develop tremors and all. And physiologically, there is known that there's a lot of beta oscillations between 12 to 20 hertz, abnormal oscillations, and there is a little bit of cortical hypoactivity. So the circuit or the networks, the striatal, cortical, thalamic circuit, what we say, is become a little bit abnormal, and that's the reason why you see this type of symptoms. So how do you recognize symptoms in Parkinson's disease? They can present in different way. Every Parkinson's disease patient is different. Some patient can just come with the pin rolling tremors, one hand tremors. They can have tremors in the legs, or they can have just a lower jaw tremors. Some patients can present just with frozen shoulder. That is reflective of the stiffness or rigidity in the limb. So they can go to orthopedician. They can just come with a stoop posture. So I think the presentation is varied. But as a neurologist, as a movement disorder specialist, we can sense that when they come into the room, we know that there's something wrong in the gait because they drag their legs while walking, or they have this tremors thing. Sometimes they'll be accompanying their family members. They would not know they have Parkinson's disease, but we question them when are you having this type of things? So that can be very subtle. So, but diagnosis is purely clinical. We don't take help of any investigations, unlike other diseases where you require a lot of investigations to support your diagnosis. Parkinson's disease diagnosis doesn't need things. So you have, the core feature of Parkinson's disease is bradykinesia. So you look for slowness in movements. One thing is visible on what you watch, and also examination of motor movements. If you can establish there is bradykinesia, along with that you have rigidity and tremors, the diagnosis is made. And typically is asymmetric. One side is affected first, and the other side gets affected. So it's essentially a clinical diagnosis thing. But when you have, like for example, red flags. So your question about Parkinson plus and Parkinson's disease. So when there are red flags, like you say, the patient has imbalance very early on. In a typical Parkinson's disease, we look at imbalance very late, after 5 years, 10 years and all. But someone has loss of balance and recurrent falls very early on, or there is symmetrical involvement. So then you tend to look for Parkinson plus syndrome. Or if there is any orthostatic autonomic dysfunction, for example, they feel dizziness one getting up very early on. Later is fine, but very early on, first year, second year, they have this type of symptoms, or urinary incontinence. Axial symptoms tend to fall backwards, lose balance early on. On examination, if we find signs like slower eye movements, then we make a diagnosis and early speech involvement. So there are certain red flags we look for. If we see that there is that type of things, we go into more details. There we require help of imaging. But again, early stage, it may be difficult. And another pointer towards Parkinson plus versus idiopathic Parkinson disease also levodopa responsiveness.
Okay.
The response to medications. That is also a very good indication. Early on, both Parkinson plus, even Parkinson plus also respond to levodopa. But with with 1 year, 2 years, the response becomes muted.
Okay.
But levodopa responsiveness is preserved in idiopathic Parkinson's. That's also a good indicator.
Okay.